Welcome to the Doctor's Warren podcast, where our goal is to educate, empower, and equip you with the health and wellness knowledge to take your wellness to a whole nother level. We're going to use ancestral wisdom, clinical research, and over 25 years combined of clinical experience to bring you an all-in-one place to learn how to take your health to the next level. So welcome. I'm super excited you're here. Let's dive in. All right, guys. So welcome. This is going to be a special podcast presentation because this is going to deal with a presentation I did about 2.5 weeks ago called The Truth About Heart Health. And, this was one that I got a lot of people that wanted, a recording. They wanted to hear it. They wanted for me to kind of present the research that we went over that night. So that they could get a better view on it. So that's what this episode is going to be all about, the truth about heart health. And we're just going to kind of take it through the presentation mode and really dive into, the lies that you're being told, broken down through research, logic, and ancestral wisdom. And I want to make sure that you understand that because I think a lot of times, we put so much emphasis on research, which Dr. Rebecca and I love research. We love, reading research. We love diving into it. I mean, over the last 2 weeks, I think we've spent, probably 12 to 14 hours, especially Dr. Rebecca diving into amino acids and protein synthesis. And we'll be doing an episode on that pretty soon. So we love research. But I think a lot of times, especially when we're looking at health and wellness, we also have to include logic. And we have to include ancestral wisdom. We can't just throw out what our ancestors have done, for thousands of years and not only surviving, but thriving and kind of getting us to this point. I always tell people your great-grandmother, your great-great-grandmother, they were probably right about a lot of things. I hear it in the office where they were like, yeah, you know what? My great-great-grandmother would make this mixture of garlic and onions and apple cider vinegar and turmeric. And, they would kind of ferment it and mix it with raw honey. And that's what we would take instead of antibiotics. And you start to look into it and look at the research behind it. And you're like, holy cow, they were right. They got it right. They were doing some amazing things there. My grandmother would use castor oil, on my feet or on a rash or something like that. And then you start to read into how castor oil on the skin improves circulation, moves the lymph. So we can't throw out ancestral wisdom. All right. And especially when it comes to the heart. So that's how we're going to approach it today. And then again, with some logic. Unfortunately, when you start to look into some of the theories behind heart disease, you start to realize there was no logic behind it. And actually, there was a specific agenda that we're going to dive into more in depth here in just a minute. So let's kind of dive into it. The first place I like to start is we have to understand where we're at if we want to figure out a better pathway forward. And so when we look at the ugly truth, here's what we know. One person dies every 33 seconds in the United States from cardiovascular disease. Cardiovascular disease, when you look at it across the board, it remains the leading cause of death in the United States, which accounts for over 900,000 deaths in the year 2020 alone. So think about that for just a second. Cardiovascular disease, not only the leading cause of death from a disease in the United States, but it accounts for over 900,000 deaths in the year 2020. Okay. Now, put it in perspective here. Are we spending more money or less money than we were, 5 years ago, 10 years ago, 20 years ago? Well, here we go. Between 2018 and 2019, direct and indirect costs from cardiovascular disease were $407 billion. Okay. So I think it's pretty easy to establish the fact that we are spending 10 times, if not 20 times more than we were a decade ago or 2 decades ago. It's not even close. So we're spending more money. Do you think we're taking more drugs or less drugs, performing more surgeries or less surgeries? The obvious answer there is more drugs, more surgeries across the board. And so the only logical conclusion that we can get to is if we're performing more medical intervention and spending more money, and yet there's more deaths from cardiovascular disease, what we are doing is not working. It's not working, right? I mean, again, this is where logic comes into play. More money, more intervention, more medicine, more surgery, more deaths. That does not equal success, okay? At all. That doesn't equal success at all. So this is where we have to dive into what happens when you walk into your doctor's office, and you may be showing symptoms or signs of cardiovascular disease. We call it standard medical care. My words in this presentation, I call it standard medical death. Okay. Now understand, I'm not knocking on, medical doctors specifically, nurses specifically. Guys, I have some of the smartest, most amazing people in the world can be in medicine, but the standard of care when it comes to cardiovascular disease is where we're really, really lacking. Even though we may have some of the most brilliant individuals, they're stuck in a broken system. So when you walk into your medical doctor's office and they do your blood pressure, they may say, oh, blood pressure's elevated. They test it once, maybe twice while you're in there. And then what's standard medical care? Well, here's a high blood pressure medication. You're on that for several months. They come back, they check it again. Oh no, it's still going up. Let's put you on a second one or a third one. You can start to see how this ball starts rolling. This little tiny snowball starts turning into an avalanche over time. Or, similar scenario, you go into your doctor's office, they run quote unquote wellness blood work, which, oh my gosh, I'll probably dive into that later, how lacking the blood work is, especially when we're looking at wellness. So they'll test your total cholesterol, your LDL, your HDL, and they'll say, oh, your total cholesterol is too high. It's 220 or 250. So what's the standard medical care? They put you on statin medications. As you're going to see in this presentation, we know that statin medications will tank your sex hormones. We know that it creates all kinds of musculoskeletal pain and discomfort. We know that it affects the way the brain functions. We know that, when you start looking at it, its effect on overall mortality is really not established in modern, medical research. And yet, so we see these secondary issues come from it. Now you're on another drug. Now you're on another drug as we go forward, and that small snowball turns into an avalanche again. So standard medical care or standard medical death really from cardiovascular disease looks like either being put on statins, high blood pressure medications, beta blockers, blood thinners. They tell you to eat less saturated fatty acids and eat more unsaturated fatty acids. They tell you to eat, exercise more, eat less, lose weight, obviously stop smoking, excessive drinking, which again, I definitely agree with. And then when all those things don't quite work together, now we're talking surgery and emergency medical intervention. So that's the way it rolls. And the unfortunate part about it is, and we see this all the time, somebody could have a cardiovascular event that is directly related to stress, whether emotional stress, physical stress, autonomic dysfunction. So we're talking about, brain, nervous system firing to the heart. And yet still they'll throw them on a statin drug post their cardiovascular event, or they'll throw them on a blood thinner just because they'll say, oh, it's preventative. And that's where I have an issue with it. I'm not anti-medicine. Dr. Rebecca's not anti-medicine. We're anti-misuse of medication. And it seems like today there's really not very many checkpoints on prescribing medication. It's just like, oh, yeah, you've got a heart issue, statins, high blood pressure medications, beta blockers, blood thinners, call it a day, right? Maybe we're not going to put you on a hardcore blood thinner, but we'll throw you on aspirin. We're going to go over some of that here in just a minute as well, too. So we can't rely on that, right? We have to focus on cardiovascular health from a wellness standpoint. What does that mean? In order to establish how we should be looking at the heart, we have to first understand the definition of health, right? And it's the same definition for every organ, every tissue, every cell in the human body. Health is not an absence of pain or disease. We have to understand that, because in our society, when we think about somebody being healthy, we think, oh yeah, they're in no pain and they have no disease. However, pain and disease are just a part of life at certain times, right? Like, we know that at certain times, you're probably going to get the flu, or you're going to get COVID, or you're going to get some type of, viral infection or bacterial infection. Those things happen. You're going to have some pain sometimes, right? You may sprain your ankle being a weekend warrior. You may injure your shoulder. You may, fall on the ground and hurt your knee, whatever it may be. Pain is a part of life. The definition of health is how quickly you adapt to those stressors, right? Physical, emotional, chemical, spiritual. How quickly does your body adapt to the stress that it's under? That's what determines whether you are a healthy individual or not. So in the case of the heart, how quickly can the heart adapt to stress? That's the bottom line. We have to understand that in order for us to establish a new standard of care when it comes to health and wellness in the cardiovascular system. So I presented it this way for a reason, because a lot of times you talk about top strategies to improve the heart or to improve a cell, an organ, or a tissue. But I want you to kind of go through these as a list and start like checking the boxes on the ones that you're struggling with or that you're dealing with on a regular basis. It's important. So top strategies that destroy the heart. And I think some of these will surprise you and you'll realize, oh my goodness, like I'm doing some of these things. It is destroying my heart. It is affecting the heart muscle. It is affecting, the cardiovascular system. So do you consume vegetable oils? Is that something that you consume on a regular basis? If you say, well, we eat out 2 or 3 times a week, there's a high chance you're consuming vegetable oils. And we know that vegetable oils, as we're going to talk about in this presentation, oxidize, right? They oxidize, so they rust your pipes, they damage your cells, they damage your cell membranes, they damage your arterial walls. These polyunsaturated fatty acids are highly damaging to the human body. So do you consume vegetable oils? Do you consume excess sugar and carbs? We are carbaholics in the United States of America. It doesn't mean that carbs are bad, but we are over consuming these things, right? We are over consuming processed sugar on a regular basis. You think about the typical American diet, and people are waking up in the morning after maybe 6, 7, 8 hours of fasting, which is not really fasting at all. So they've still got food in the gut from the night before, and they're waking up, they're having a bowl of cereal, with conventional cow's milk, which again is sugar on top of sugar. Then for a snack, you may have the donuts that somebody brought into work and you say, oh, I'm only going to get a little bit. And then for lunch, you're like, oh, we're going out to eat. So you grab something quick that has a bunch of vegetable oils, processed sugar, and more carbohydrate. And then at night, you're like, oh, okay, well, now I'm going to have pasta or pizza or bread. You can start to see where by the end of the day, I see this a lot clinically. You may think, oh, I'm not consuming a lot, but then you count it up and you're like, oh my gosh, I'm having 450, 500, 600 grams of carbohydrates on a daily basis. That's why you have a high A1C, and that's why you're insulin resistant, and that's why you have metabolic disease. We're carbaholics, we're sugar, kind of consumers in this country at an excess level. Do you smoke? Right? This is something that's well established. We know that can affect cardiovascular disease. It can advance that process. Why? Because it's going to oxidize tissue and cells. How much sunshine do you get? When you start looking at surveys and certain studies, it'll shock you. The average American child in the United States is spending less than an hour outside. I mean, that's guys, that doesn't equal life. That equals death. And those are our kids, which means they're probably getting more outside time than you are. No connection to the earth, right? I mean, especially when you talk about big cities and where most people live in the United States, they're never spending any time grounded to the earth, right? Barefoot on the ground, gardening, taking hikes, getting out into nature. We're designed for those things. Are you eating artificial sweeteners and colors? I mean, again, when you start looking at all the red dyes and the yellow dyes and the artificial sweeteners like Diet Cokes and aspartame, and sucralose and all of these different things, we know they have a negative impact on the human body. Are you breathing in indoor air all day long? Are you sitting most of your day with little movement? Well, guess what, guys? That is our modern lifestyle. And especially since COVID, I know that it's, a lot of people are really excited to work from home. But one of the things I've found is that when people have this idea of working from home, they don't just work, like they would at the office and go home at 5 and, then spend time with their family. They seem to be working later. So they're working 7, 8, 9, at night, and they've been sitting all day and they're breathing in indoor air, which is much more, it's highly toxic compared to outdoor air, even though outdoor air can have pollutants. We know we're breathing in a lot of endocrine disrupting, toxins inside the home. Do you have poor posture? We're going to go over that in this presentation on how the cervical curve of the spine and how, the nerves that branch from that and the spinal cord itself, how much they directly affect our heart. When we look at, are you taking things like NSAIDs? Are you taking these anti-inflammatory prescription drugs at inappropriate times? These things we know have side effects. Are you isolating from people? We still have a group of people, especially since COVID, that are, really kind of still isolating from people because they're scared to death of coming in contact with whatever may be out there, whether it's viral bacteria, whatever it may be. And one thing we learned from the last, from the pandemic is, dude, you're not going to hide from it. You're not going to mask your way away from a viral infection. Like, you are meant to be around people. You are meant for community. Isolation equals death, period. That's not even debatable. We have to be around people. Watch the news and live in fear. I mean, one of the best things that we can do right now is turn off the freaking news. Fear sells. That's all they sell you, whether it's dealing with politics, whether it's dealing with COVID, whether it's dealing with other health issues. I mean, it's all based on fear. 90% of it is junk and it's lies. Turn off the news, right? But how many people, that's literally what they do all day. They're under stress at work, and then they come home and they veg out in front of their TV watching the news, which is full of fear and lies, right? You got to look at this list and say, what am I doing on this list? Because it's killing me and it's destroying my heart. So I put this one in here because so many people are taking aspirin because years ago they talked about it being good for your cardiovascular system, thinning the blood, those type of things. And so I put this study on here. This is from the British Medical Journal, and it was published in 2009. By the way, the guidelines for aspirin have changed, but we also know, based on a big study from the Journal of American Medical Association, when you look at the amount of time for research to come out and then for it to enter your primary doctor's office, you're talking about on average 17 to 20 years, guys, almost 2 decades for the information to come out and for it to actually change standard medical care. 2 decades. Do you know how many people die and create disease and dysfunction in 2 decades? It's massive. So we have to understand this. So when we look at aspirin, something that people are popping like it's candy because they think it's good for their heart, cardiovascular morbidity and mortality, when you look at it, that's major concerns within the diabetes community. So what I love about this is they took not healthy patients, but they took people who are sick, right? So they looked at a sick population, which, by the way, guys, you're talking about well over a third of Americans are dealing with diabetes or pre-diabetes. And then you could probably throw another 50 to 80 million people on that have underlying pre-diabetes symptoms that are going undiagnosed, right? So we know that metabolic disease is big. And so when they took this group of, sick individuals, here's what they found. The impact of aspirin in patients with diabetes was reviewed in a meta-analysis that included 6 randomized controlled trials. Okay. So over 10,000 participants, and they looked at all this information and they pulled it together. And here's what they found, that there was no significant difference between aspirin and the control group for important outcomes such as myocardial infarction, so heart attack, for stroke, and for all-cause mortality. So think about that. The reason why somebody's taking aspirin to begin with, and in the population that it would be pushed on the most because they're more at risk of cardiovascular disease, it showed no difference, no significant difference between the control group, so the group not taking aspirin, and the group that was on aspirin for heart attacks, stroke, and all-cause mortality. 6 randomized controlled trials showing this. And yet we also know that aspirin has some pretty serious adverse effects, especially when we look at over time. We know that these effects, these side effects, get worse over time the longer that you're on this medication, just like any medication on the planet. And those things can include, excessive bleeding, gastrointestinal bleeding, right? How many gut dysfunctional, diseases do we have in the United States? I'll tell you, it's usually about 7 to 8 out of 10 that come in and see me in my clinic. Gastrointestinal symptoms. These are some of those things that we see. So again, this is from the British Medical Journal. So we have to think differently. Even though you may hear that aspirin is preventative, obviously it may not be the whole picture. And let me make this very clear, okay? I am not telling you to jump off your medications. That is not what I do. You need to discuss this with your medical doctor before making a decision about your medications. Understand that you need to consult them. But what that means is you need to have a real discussion with them. And a real discussion does not just mean that a person in a white coat says, you need to take this medication because I say it's good for you. No. It needs to be, hey, let me show you why I think this is good for you. Let me give you the percentages of what this is going to help, in your outcome to lead to a positive outcome. Not some just random, oh, no. I say it's good for you because I know, because I went to medical school. That's not enough anymore, right? It's not enough. Just because you play golf with, your medical doctor does not mean that they're looking out for your best interest when it comes to your health. So yes, consult a medical physician before changing your medications, but actually have a real discussion on it. And if there's no, studies presented, if there's no percentages given that are actually backed up by science, it may be time to fire your doctor and have another discussion with somebody who's actually looking into your wellness and the benefit of your health overall. Okay. So let me make that very, very clear. Now, here's what we're going to really focus on. And this is what I talk a lot about in the presentation. When we come to the cardiovascular system and the heart, we've got to focus on mitochondria and cellular health. Why? Because you are made up of cells. You are made up of cells. And when we start to look at the amount of mitochondria concentrated in your cardiovascular cells, now all of a sudden we start to realize it's one of the richest areas of mitochondria. So if you are not taking care of the power source of your cells, you are creating disease and dysfunction on a daily basis. So we have to make sure that we're taking care of the mitochondria and our cellular health. Number 2, we have to focus on circulation and nitric oxide production. These are important, right? If one of the primary things that your heart does is, it's some areas of medicine look at it as more of a pump. There's other areas that you're starting to see kind of new theories on it being more of a kind of a vortex and being able to, kind of control and limit where the blood flow goes, to, how it's able to oxygenate the tissues. So we know there's even other theories around that as well. Either way, blood flow, nitric oxide production, these are important for cardiovascular health. The arterial lining, guys, this is massively important, especially from some of the things that we've been through over the last few years, especially when you're starting to look at some of the studies coming out, not only on getting, COVID, getting SARS-CoV-2 and any of the variants and what it can do to your arterial lining, but also some of the things that we're seeing, come out and presented from a vaccine standpoint with the COVID-19 vaccines, right? We know that there are some early evidence of arterial lining damage, massive amounts of blood clotting that are happening across the board. So these are not something we're going to ignore. And they may tell you, well, there's not enough evidence to prove that. Well, to me, there's enough evidence to at least make me pump the brakes on whether or not that's a good decision. Right. So there are some early preliminary studies showing arterial damage from the COVID-19 vaccines, as well as from, SARS-CoV-2 and any of those variants as well, too. Nervous system structure and structure, right? We know structure equals function. It's a basis of biology. Okay. You change the structure, you change the function. Well, guess what? The most important system in the human body is the spinal cord. When you look at the spinal cord, it's a first thing formed in your mother's womb, which gives you a clue. What's the most important thing? From there, we have the brain development, the nerve development, tissue, cells, tissue, and organs that come from that. But bottom line is, we also know that spinal cord that controls the signals from the brain to the body and to the cells, that controls your stress adaptation, your parasympathetic nervous system and your sympathetic nervous system, rest and digest versus fight or flight. Guess what? The structure of the spine directly affects the function of the nervous system. And oh yeah, by the way, it's your brain, your spinal cord, your nervous system that controls your heart function, right? The heart doesn't just beat magically. It happens because of the signals sent from the brain. Okay, so we have to understand how important that is. Adaptation to stress. Again, that's the whole entire definition of health. How well are you adapting to stress? Regardless of what it may be, is what determines whether or not you're a healthy individual. Adaptation. So, in order to establish where we want to go, we have to look at what heart disease, like the foundation that it was built upon. This whole theory on cholesterol causes heart disease. It was built on a faulty foundation. All right. And I'm going to prove that to you today. So in the 1920s, heart disease was very rare. You just didn't see it a lot. It didn't mean you didn't see it at all, but it was a rare thing. There wasn't a whole lot of cardiologists because they weren't needed. The American Heart Association was very small because, again, it wasn't a needed thing. It just wasn't something that you see happening all the time. Heart disease started to skyrocket in the 1940s and 1950s. And I think it's important to understand there were a couple big factors here that could have contributed to the drastic rise of cardiovascular events throughout the 40s and the 50s. And so some of those things look like, interesting enough, through World War II, which lasted years, there was less meat consumed because there was less availability, less ability to get it out to people, trying to actually feed people, more calories. So they went to nutrient lacking foods because they were able to get a lot down them. And again, less meat was consumed. Okay. What are some of the other things that happened? Oh yeah. The introduction of vegetable oils and seed oils. They replaced kind of the traditional fats like butter, like, things like beef tallow and, beef fat, lamb fat, some of the things that were primarily consumed by your great-grandparents and your great-great-grandparents. They were replaced by industrial vegetable oils because you can make them cheaper. Again, restaurants could use them a lot easier, and they were touted as this super healthy, amazing thing that everybody should switch to. And yet, 1940s, 1950s, we saw a major skyrocket of cardiovascular disease. Well, it just so happened at that time, there was a University of Minnesota scientist. His name was Ancel Keys. And this guy is very, very important to the overall theory. He's the guy that came up with the theory that cholesterol is the primary culprit of cardiovascular disease. So really, he set out on a mission to prove that dietary fat or cholesterol is a primary cause. And so this is all despite him publishing his own experiment in the early 1950s that said the contrary, right? That dietary cholesterol intake did not raise cholesterol levels. And yet this guy continued to push this theory that wasn't even supported by his own experiments. And you'll see he did another one later on as well, too. But really where it kind of got started that a lot of you guys have heard of is called the 7-country study. It started out as the 6-country study, and then he added another country in there. And so now, like, the big one is that's kind of the buzzword out there is the 7-country study. And so Ancel Keys really cherry picked 7 countries, to get his association that he was looking for when it came to, cholesterol intake in the diet and causing cardiovascular disease. He chose 7 countries, even though there were 22 countries that we had, epidemiological information on that could have been used. So do you understand that? That means when you look at it, this guy left out, 15 countries that could have been used in this study to look at it. And he did that on purpose so that he could get the association he was looking for. So a few examples, he left out France, Switzerland, and Chile, right? Which, again, especially in today's modern world and even back then, traditionally have much better health outcomes, less cardiovascular disease. Their overall, expected lifespan is much higher than ours. And yet these were the outliers, so he didn't include them because their diet is actually high in fat consumption, and yet they had low instances of heart disease. So they were mysteriously left out of the study. The guy cherry picked these countries to get the information that he was looking for. And so here's some of the problems when you look at, kind of putting together a study like this. Now, when you look at epidemiology and you look at how it's viewed, it's basically just kind of like looking at a giant group of people and you're looking for associations, not causation. So this is very, very important. So epidemiological studies do not conclude causation, all right? Only association. And so they're lower on the research totem pole. Doesn't mean that there's no benefit to them, but the only real reason that epidemiology is useful is if clinical trials are then done to look for causation from the association that was developed during those epidemiological studies. And unfortunately, when you see it done this way, a lot of times what you're going to then see is something called, healthy user bias, right? Where you actually see this bias towards a theory that was already established. And now you're trying to prove that theory, right? Instead of trying to disprove that, right? Which is kind of what science is based on, right? Not only proving, but disproving. Right. That's why when you hear the words like we heard, some of the buzzwords, spoken by some really, really unintelligent individuals that kind of led the COVID pandemic with things like the science is settled. That is one of the dumbest statements that any doctor or scientist can actually ever say. Why? Because the science is never settled. That's not the point of science in general. And so you got to be careful when you're looking at these epidemiology studies that came out. And that's what this 7-country study was. The other problem with these type of studies, especially when you're looking at these epidemiology studies, when they're looking at food, is they primarily use something called food frequency questionnaires. So this would require people to not only remember what they ate, yesterday, but how many of you guys can recite for me or write down or even remember what you ate 3 days ago? How about a week ago? How about 2 weeks ago? How about a month ago? How about years ago? So you can start to see where it's almost silly, right? And again, I'm not saying there's no need for some of this and it can't give us some decent information, but you start to see where this is a very slippery slope. And most people are going to be inaccurate when you're looking at these food frequency questionnaires. We already talked about the bias that kind of goes along with this. And the bias was not necessarily a problem when the 7-country study was done. The bias really comes into play after that kind of 7-country study was established as the standard, right? The foundation. Now you can see where all studies come from that. Like we saw a major issue with this, I think it was probably 2 or 3 years ago when we found out that, there could have been some, misrepresentation and some issues with, kind of the foundation of Alzheimer's, diagnosis, treatment, all these things, like kind of what causes Alzheimer's. There was the foundational studies were shown to be, there could be some fraudulent activity here. And yet all the basis for drugs, for interventions, they were all established based on these kind of foundational studies. That's where bias could be really, really dangerous. And then the other problem is this: understanding the difference between relative risk and absolute risk. So you don't have to be a statistician to understand one of the most important things when it comes to studies. So a good example of the difference between relative risk as opposed to absolute risk is this. So let's say the overall baseline risk of developing heart disease is 1% for each person. And then you do a study and it shows that eating animal fat raised the risk to 1.5%. Okay, so if we say what's the absolute risk, we'd say that's a 0.5%, increase, which is really not significant at all, going from 1% chance of cardiovascular disease to 1.5% chance of cardiovascular disease consuming animal fat. But now when we look at the relative risk, that would be going from 1% to 1.5%. Relative risk elevation would say, there was a 50% increase in the development of cardiovascular disease when you consumed animal fat. Which one do you think gets better headlines, right? Which one do you see the buzzwords on your Apple News feed when you're looking at, all these different articles? So we have a major problem with this in our society, that news media and media outlets, on Twitter and on all these, I guess it's called X now, and on all of these different social media outlets, they love to get the headlines. So they love to report on relative risk as opposed to absolute risk. So you can really manipulate and create a lot of fear and drive an agenda when you're reporting on relative risk as opposed to absolute risk. So you have to understand that you can make these numbers say whatever you want. Now, Keys, Ancel Keys, his whole entire faulty science, became the primary theory after President Eisenhower had his first heart attack. And so the personal doctor of President Eisenhower was Dr. Paul White. And you have to understand, during this time, President Eisenhower was a beloved president. So when he had his heart attack, this was a big deal. And so Dr. Paul White, his personal doctor, literally mentioned Ancel Keys by name and basically established that this guy's theory is the driving theory of cardiovascular disease. So it was the reason they kind of grandfathered in this idea that saturated animal fats were clogging the arteries. And really this became the foundation of establishing, proper drug therapies like statin medication, and then modern surgical procedures like bypasses and stents, all from this one theory that consuming saturated animal fats and cholesterol in the diet is the primary cause of heart disease. So you can see how, once you establish kind of this faulty foundation of this theory on cholesterol causing heart disease, how it literally led to how we treat heart disease today. And we already went over, we spend more money on heart disease than ever before. We take more drugs for heart disease than ever before, and we have more medical interventions than ever before. And yet we have more deaths from cardiovascular disease. You see how these things don't line up. If what we were doing was working, we would have much less. But that's not what we're seeing across the board. Now, around the same time, just to kind of dive a little bit more into the history, there were a couple really key scientists that were doing some great work. However, you didn't hear about these guys. You had somebody like Dr. George Mann, who was studying the Maasai tribe, and when he looked at this tribe, it was a diet full of animal fat and raw milk, and they even consume the blood of the animal, to make sure they're well hydrated in the environment that they're at, and to consume, enough things like iron and certain, vitamins and minerals that come from the blood. And yet they had basically no heart disease, right? In looking at this kind of ancestral tribe. And then you had somebody like, Giorgio Beraldi doing autopsy studies showing that clots in people who died from something other than heart disease, and yet some of the heart disease deaths had no clots. So you had some people that did not die of heart disease that had clogging, quote unquote, clogging in their arteries, and they died from something completely different. And then you had heart disease deaths that had no clots. But yet you didn't hear about these guys because there was one primary agenda and theory that was being pushed in our public that developed the foundation of how we look at heart disease. So to continue on with this, in the 1960s, the Minnesota coronary experiment, this is very, very important. Okay. So it was around the same time, right after they kind of established all of the, this theory on cholesterol being the main cause of heart disease. The same area of the country the Ancel Keys came from, the Minnesota coronary experiment, they looked at about 9,400 men and women, and it was conducted over 5 years. And so they changed their diet from consuming saturated fats to consuming things like unsaturated fats and vegetable oil. And what the finding shows was the complete opposite of what they wanted. So what it ended up showing is that saturated fatty acids actually prevented heart disease, while vegetable oil and unsaturated fats increase heart disease, and specifically polyunsaturated fatty acids. And here's what's interesting. Guess who was the primary investigator on this study? You got it right. Ancel Keys, same guy, right? He keeps popping up here. And guess when it came out? It didn't come out till years, decades later. This study was not published until later down the road. And so they didn't publish it right after they got their findings. Why? Because it could have affected the primary theory in which all of these interventions were being built off of in our standard medical care. And guess whose name was mysteriously left off of the study, even though he was a primary investigator? Ancel Keys. Now, if you don't find that fishy, then you're probably going to buy oceanfront property in Oklahoma, because this is a big issue. Not only did they delay the publishing of this study to continue their theory to build traction, but he left his name off of the primary study that showed the complete opposite of his theory. Now, an updated look at this study that was published in 2016, here's where it actually starts to get interesting, okay? So it actually did show a decrease in overall cholesterol. So that means when these participants consumed, animal fat, they did see that their cholesterol was more elevated than those that consume these unsaturated fatty acids. However, listen to this, but it also showed a 22% increased risk of overall death for every 30 milligrams per deciliter that their cholesterol dropped. So let me repeat that. For every 30 points that they saw the cholesterol drop, they saw a 22% increase in overall mortality. So right off the bat, this is even more disturbing. That means you had a greater risk, a much greater risk of death when you saw your cholesterol drop. And I'm going to show you some other studies that actually, again, support this idea. Around the same time, there was another study, Sydney Diet Heart Study. It was conducted from 1966 to 1973. And they looked at 458 men who did the same thing. They replaced saturated fatty acids, so primarily animal fat, with unsaturated fat, primarily vegetable oil. And here's what they found. That substituting a dietary linoleic acid, so again, unsaturated fatty acid, in place of saturated fats, increased the risk of death from all causes, coronary heart disease and cardiovascular disease. So it increased the overall mortality risk, and it increased your risk of coronary heart disease and cardiovascular disease. Now, just like the previous study, guess when it was published? 2013. So even though they had their findings done in 1973, they did not publish the study until 2013. So we're talking about 40 years later. How much false information, how much medical standard of care was established during this time, how much brainwashing was done to the public to buy into this theory that cholesterol was the primary cause of heart disease during that amount of time. And yet it showed the complete opposite. Something's wrong there. So now let's take a look at what does research actually say? What are some of the studies that actually show something different? We have to kind of establish this. So here's a study, that was published in the Annals of Internal Medicine, right? So really looking at in the Internal Medicine Journal, 2014. And here's what they did. They looked at a meta-analysis of 72 dietary studies, right? 72 dietary studies. And they were kind of looking at reducing cholesterol blood levels by reducing dietary saturated fats. So again, animal fats, even though it's commonly recommended. What did this meta-analysis say? These 72 dietary studies concluded that reduced consumption of saturated fat does not reduce cardiovascular mortality. That's the important factor here. We do not want to just look at studies and say, okay, well, does saturated fat, intake reduce cholesterol levels? That honestly does not matter, because what we should be concerned about is mortality, right? What are our risk of overall death? What is our risk of heart attack and stroke and those type of things? That's what we should be more concerned about, rather than does it lower our cholesterol overall? And so they concluded 72 dietary studies that reduce consumption of animal fat or saturated fat does not reduce cardiovascular mortality. 72 studies. And then you have the Lyon diet heart study, right, that utilize the Mediterranean diet. So kind of flip it on its head, and let's actually look at a lifestyle change. So by consuming a Mediterranean diet, they reported a 70% reduction in mortality. 70%, right? Just by changing your diet alone. That's huge. Even if that study was overreported or ballooned, even if it was 30% overall mortality reduction, that would be huge. They showed 70%, right? Looking at the Lyon diet heart study. Now, the same study was achieved without a reduction in cholesterol levels. So let me repeat. When they looked across the board at this study, the individuals that were in this study did not have a reduction in their overall cholesterol levels. And yet it showed a 70% mortality reduction. What does that mean? We should not be focused on lowering cholesterol. This faulty foundation of cholesterol being the primary cause of heart disease is not correct. And the science is proving the opposite of that, right? That we have to understand that. They achieved it without a reduction in cholesterol levels. And that study was published in The Lancet, right? A very prominent medical journal. Now, let's dive into some more research. So this is kind of looking at statin trials, okay? So this one was looking from the chief editor of Cholesterol and Statins, okay, from France. So when we look at it, here's what they talk about. Early statin trials reported significant mortality benefits, yet serious concerns have been raised in some studies regarding biased results, which we've already went over, premature trial terminations, so stopping the study right before it started showing the opposite of what they were saying, and underreporting adverse events. Now, we have to understand this, because this is important. How could this happen? Well, in another journal, in the Arthritis Rheumatoid Journal in 2006, here's what they showed. Here's the reason why that is significant to look at, that these studies, these early statin studies that showed a decrease in mortality benefits, and they had bias, and they stopped these trials prematurely, and they lost a lot of follow-up patients and oversight over pharmaceutical companies that sponsored it and underreporting adverse events. Here's why it's important. Because in 2005 is when we really saw major regulation changes on studies, right? On how clinical trials were ran, right? New regulatory rules. And the reason why these new regulatory rules were established in 2005 was because if you guys remember some of the big painkillers like Vioxx and Celebrex, this is what led to these new regulatory changes. Because if you remember the drugs like Vioxx and Celebrex, we had a major underreporting of risk of heart attacks in the patients that took these. Like we're talking about, 70 to 90,000 people. And I'm sure that it's probably 10 to 20 times more that died as a side effect, a heart attack as a side effect to taking Vioxx and Celebrex. So this kind of turned it on its head. Now, here's what's interesting. Once they change the overall regulatory rules of clinical trials in 2005, mysteriously since 2005, statin trials have failed to demonstrate a consistent mortality benefit. So let me repeat. Once they made it the rules stricter, right, when it comes to regulation on clinical trials, statin medications have failed over and over and over again to demonstrate a consistent mortality benefit. Mysterious, huh? Now, as we continue, let's look at what else these statin trials, have shown. Okay, so we're going to look at just kind of like what we did with aspirin. Let's look at what the majority of our country is dealing with, which most of our country is not healthy. Like we know that, okay? That's not an opinion. That's a fact. We know that when we say normal in this country, it usually means sick, suffering, and dying, okay? Statin trials in the elderly, which we know, as you age, your increase of mortality from cardiovascular disease goes up. And so this study was called the Prosper study, and they looked at it in the elderly. Then there was another study, right? Actually, two different studies. One of them was called the Corona study. One was the GISSI-HF study. These were looking at patients with heart failure, okay? And then three other studies looking at people with renal failure, the 4D study, the Aurora study, and the Sharp study. And all of those, so study clinical trials dealing with the elderly, heart failure patients, and renal failure patients have all failed to demonstrate a mortality benefit. All of them failed to demonstrate a mortality benefit when we're looking at statin drugs and some of the people that are most at risk of a cardiovascular event. So how much more do you think, that it's going to fail to demonstrate a mortality benefit in people that are healthy, right? Do you see where I'm going with this? And this one was published in the European Heart Journal. Okay. Now we look at a Cochrane meta-analysis of statin usage. This one was published in 2014. And they looked at like an overall meta-analysis looking and breaking down clinical trials. And what they found is after acute coronary syndromes, so after like an actual cardiac event, they concluded there was no, let me repeat, no mortality benefit. Now, that's not it. Let's continue on. The cholesterol treatment trialist, this was published in British Medical Journal, performed a meta-analysis of 27 statin trials. And what they showed overall is that these 27 trials, when they were assessed for mortality outcomes, there was no benefit seen. Remember, we have to look at mortality outcomes, right? So there was no benefit seen overall, and that one was published in the British Medical Journal. Now, let's continue on. We know that diabetes, we already established, is definitely going to increase your risk of cardiovascular disease. So what they found is in 3 randomized control trials, so the CARDS trial, the 4D, and the ASPEN trial, they specifically designed and powered to assess the effect of statins in diabetics they all failed to demonstrate a mortality benefit. We're not done yet. Primary prevention of cardiovascular disease, looking at statin drug and type 2 diabetes in the collaborative statin diabetes study. So the CARDS trial, that was published in the Lancet. The diabetes statin trial that we talked about, earlier when we look at the 4D study, this was done in the New England Journal of Medicine, and then diabetes care with the aspirin trial. So again, these were published in primary medical journals, and they showed no benefit of mortality risk. Okay. The coronary calcium score, this is important to look at too. This one, when you look at the calcium score, we know that there's a lot of benefits to getting this calcium score done, right? Some people would even say it's the gold standard of understanding, how at risk somebody is of dying from a cardiovascular event. And what they showed is that healthy individuals in their randomized statin therapy that were doing that showed no overall clinical benefit to taking a statin. So it did not, decrease their calcium score. When you looked at healthy individuals, right, and you looked at their calcium score that were put on statin drugs, it did not decrease their overall mortality risk. And that was from the Journal of American College of Cardiology. Now, when we compare lifestyle versus standard medical care, so we kind of went through some of these statin trials. We went through some of these cholesterol, as the cause of the heart disease, and why that is absolutely a faulty foundation. Now let's compare them to lifestyle studies, okay? So epigenetic studies, and you guys have heard me talk about this all the time. I like to use the term that genes are the loaded gun, right? They're the loaded gun. But we also know that lifestyle is what determines whether it pulls the trigger or not, okay? Your lifestyle is far more important than your genes. Doesn't mean that genes aren't important, but lifestyle is far more important when we're looking at that. It's above the genetics, epigenetics, okay? Your lifestyle determines whether genes are expressed or not expressed. Important to know, okay? So epigenetic studies have shown that Mediterranean diet, so changing your diet, can favorably alter the expression of atherogenic genes. So what does that mean? That means by changing your diet to more of a Mediterranean diet, which we'll go over what that means here in a little bit, they showed that it had a favorable outcome on gene expression. So if you are more predetermined in your genes to get heart attacks or strokes or other cardiovascular events, maybe your grandmother, grandfather, great-grandmother, great-grandfather, they died of a heart attack or a stroke, so you're more at risk. What they showed is that by changing your diet actually altered whether those genes are expressed or not. Now, when you counter that, and by the way, that was published in the British Journal of Nutrition in 2012. Now, when you compare that with statin trials that were trying to show genetic effect, right? So an effect on gene expression. So in a study in 2014 in the Journal of Atherosclerosis, here's what they showed. The cholesterol-lowering statin medications in their trials failed to demonstrate a similar effect of affecting your gene expression. So diet and lifestyle affects your gene expression. Statin drugs do not. Okay, that's a huge, kind of a primary foundation that we need to build off of to understand that lifestyle is going to have a bigger effect on cardiovascular disease than drugs ever will. Okay. Now we look at another one. So at the cellular level, we know that atherosclerosis is an inflammatory disease. Okay. We know that. We know that inflammation plays a major role in somebody's risk of having a heart attack or a stroke. And primarily what we're starting to see is that things like macrophages and T lymphocytes and parts of the immune system play a dominant role. And yet we also know that recent studies have demonstrated that the Mediterranean diet can reduce markers of inflammation. Okay. But we also know that when you take certain drugs, for example, Vioxx and Celebrex, They were actually designed for pain. Why? To try to lower inflammatory states in the body, and going off of, biochemical inflammatory pathways. What did they do? They actually increased some of the most important adverse events when taking Vioxx and Celebrex were what? Heart attacks. So again, comparing lifestyle with drugs, we can see that lifestyle and dietary change can reduce markers of inflammation that can actually be found in blood work, as opposed to things like certain drugs that are supposed to lower inflammation that can actually increase your risk of heart disease. That one was published. It's the Atticus study, and it was published in the Journal of American College of Cardiology in 2004. So again, lifestyle is going to have a much bigger effect on your gene expression and on your overall heart health and chances of cardiovascular disease. So as I've always said on my radio show, and Dr. Rebecca has said, it's kind of been a staple of our radio show, for the past 7 years. We've always said this: a prescription script is just a permission slip to continue to live a crappy lifestyle. We see it all the time, right? Now I'm going to give you a study that kind of proves that. So Journal of American Medical Association, Internal Medicine, in 2014, they did a report where they looked at gluttonous behavior among statin users who mistakenly believe that they are protected by taking statins, and so therefore they eat whatever they want. Well, we see this across the board. I see this in all areas of medicine. When somebody takes let's say a pill for high blood pressure, they now think that their overall risk of cardiovascular disease is reduced. So therefore, I can continue to live a lifestyle that's led to high blood pressure. And just so you know, when your body is, let's say it develops something like high blood pressure, that's not a random act or a mistake. Okay. Bottom line, your body is intelligently designed. It doesn't make mistakes. The only thing the body does is adapt to its internal and external environment. So it has to pick and choose how to adapt to try to make the best decision to keep you alive. Again, this isn't an opinion. This is a fact. The body's always going to try to choose the best possible outcome to keep you alive. Now, sometimes it has to choose between a rock and a hard place. For example, if you are 20, 30, 40, 50 pounds overweight, and the body says, oh my gosh, I have to circulate blood at a higher level. Well, then guess what that means? That means your body's going to pump it, again, kind of raise its overall processes of pumping blood, AKA high blood pressure. And you look at that and you say, oh, that's a random mistake, when in reality, it had to do that to keep you alive. And so now you're on a high blood pressure medication and you're still eating the same crappy food. You're still not working out and moving. You're still not getting proper sunshine and air consumption. You're not drinking enough water. You're under massive stress at work and at home. You're doing nothing to mitigate the stress. And now you wonder why so many people are dying of heart disease, and they're on blood pressure medications, statin medications, beta blockers, and blood thinners. Guys, bottom line is, a prescription script in our society is a permission slip to continue to live a crappy lifestyle. Now, if we flip that on its head and we said, hey, there's certain times and places for drugs and medical intervention. But what if while you were taking, let's say a high blood pressure medication to save your life in the moment, right? We know that certain drug therapies can save your life in the moment. There's no doubt about that. I'm not arguing that. But what if you actually started to change your lifestyle? What put you in that process of developing high blood pressure? You started working on the root cause so that what could happen? So that your blood pressure goes down on its own and you're able to come safely off that medication with the help of your medical doctor, and you no longer need the high blood pressure medication because you got down to the root cause. That is why we cannot just rely on, drugs and surgery interventions to take care of our health. You cannot cut and poison and burn yourself to health. Those things can save your life in a moment, but they will not get an individual healthy. That's why I do not like this whole idea of preventative medicine. Medicine is not preventative in any way. Okay? Food can be preventative. Lifestyle can be preventative. Supplementation can be preventative. Those type of things, health and wellness can be preventative. Medicine, no way. No way. It is not preventative.
Thank you for tuning in to the Doctors Warren podcast. If you enjoyed today's episode, I'm going to ask 2 favors. Number 1, if you could leave us a 5-star review. Not only do we love to hear from you guys, please let us know how this information is helping you. But by leaving that review, you allow us to reach more people with this message. And number 2, make sure to subscribe. That way, when a new episode pops up, you get immediate access to it. You can also go to our website if you're looking for help with consultation, want to join our newsletter to get the most up-to-date health information sent straight to your inbox, our supplement protocol, and more. By going to our website at doctorswarren.com, DRSWARREN.com, we do consultations both locally in Chattanooga, Tennessee, and virtually worldwide.